So you have 14-year-old girl. Her name is Lavi. She is having headache for last 2 weeks. So she has come with her mother. Her mother's name is Asmita. So please take a focus history and discuss the management plan with them.
Right.
Okay, Mala?
Yes, sir.
You have 3 minutes, okay, Mala, for you. So
Yes, sir. Yeah, yeah.
Yeah, are you ready?
Okay, sir.
Yeah.
Hello, good afternoon.
Good afternoon.
I am Dr. Marla, one of the doctor working in this hospital. I believe I'm talking to the Asmita, mother of the Lavi.
Yes, doctor, this is Asmita. Right.
So how can I address you? Asmita is fine to you.
That's okay, doctor.
Okay. Today we are here about Lavi's concerns. Meanwhile, I take some notes to write about its condition. Is it fine to you?
That's okay.
Okay. So, Mrs. Asmita, can you tell me what is your main concerns that you brought today? I read
Doctor.
letter from the GP that she has a complaint of the headache. Can you elaborate more?
Yeah, sure, doctor. Uh, so Lavi is now she's 14-year-old and she's having headache for last 2 weeks and we are very much worried about it, doctor.
I really understand your concerns, Mrs. Asmita. So, can you tell me where is the site? Is all over the head, or it's a particular site?
It's like, it's all over, doctor, actually.
Okay. And if I give you a score of like 0 to 10, so how is severity?
Can say, doctor, it's around 8.
Okay, I can really
Okay.
understand. It will be really stressful for you both. So, how is like is how it start? It start like sudden or gradual?
Yeah, so gradually it started, doctor. Like, initially it was kind of like, it's the leaking, and I thought maybe because of the, some issues, okay, with the sleep or something like that. But later it progressed over a period of time, and it's no disturbing my activities, her activities actually.
Yeah. So, can you tell me like is pressure pain is how like and headache is how like it's like pressure like or bending?
Now it is like, kind of throbbing, kind of, you can say, something is done, hitting me, like,
Yeah.
it's worsened actually. Yeah.
Okay, okay, Mrs. Asmita. So, can you tell me like where it radiates to any other side from this head, any other body parts?
No, I didn't notice any radiation, doctor.
Okay. And what about is you feel like this headache is associated with any throwing up or any other thing?
Yeah, yeah, throwing up is there. For last 1 week, throwing up is happening. Yeah.
So, how is like any specific time of this throwing up, or it's all over the day?
More so in the morning hours, doctor. So the headache is also more, and sometimes I vomit.
Okay. Okay, Smita. So, can you tell me like is it like on the forceful this throwing up or is away from the clothes? How is? Can you elaborate more this throwing up
Yeah, the throwing up sometimes, okay, it goes far away.
far away? Okay. Okay, and you feel like anything that increase this throwing up, means this headache increase this throwing up, or anything that relieves?
Um, it is more so, it is more in the morning hours, doctor, but yeah. So after taking some medicines, my pain, okay, it goes away, but again, it comes back.
Okay, Smita. So like this same headache and this throwing up mostly in the morning time, is it?
Mm.
Okay. So any other thing that you feel for like this headache, any fever?
No fever.
Okay, and you are like concerned about any weight changes or you feel
Mm,
from his pillow?
yeah,
Hmm.
we have concerns for the weight. Okay, her weight is high, doctor, actually. So she is, having 75 kg weight.
First it was the
75 kg.
okay. Now it's 45 kg.
75 kg. 75.
Yeah, yeah. First it was 75 kg. I'm asking for now. How is the now weight?
No, yeah, so the weight is high actually. So doctor has advised for, the dieting and some exercise, but yeah, so she has to reduce the weight. Yeah.
Okay. And what about appetite?
Appetite is okay, but worried about, throwing up after eating sometimes.
Okay. And what about sleep?
So recently, for last few days, sleep is disturbed because of this headache. It's
Yeah, I can really understand.
yeah.
This pain is like a very worse in the. So can you tell me like any abnormal movement that Lavi feel it
Not
will
about,
call?
um,
Yeah.
uh, she used to say that she can see, two objects at a time, like, so sometimes.
Okay. Okay. Yeah. And what about any abnormal behavior nowadays?
Yeah, for last 2 weeks, so she's more irritable, and getting irritated with small things also.
Okay. And have you checked any time the blood pressure of the Lavi?
Yeah. So when last time when she was admitted, so her blood pressure was on the higher side, but they told that okay, you can control the weight, so the blood pressure will also get controlled.
Okay. And what about any lumps or bumps on the body?
No, we couldn't notice anything like that.
And anytime she complains of any bone or joint pain?
Mhm.
Okay. What about like cough? Is she
What
complain
is
of any cough or no?
what is pica, doctor?
Cough. I am asking for cough,
Oh,
Asmita.
okay. Okay. So no, not that.
Okay. And what about any heart racing when she climbs the stairs or when you hug her? You feel for any heart racing?
I didn't notice anything like that.
Okay. And what about any like the tummy pain
No tummy pain.
and any tummy size increase?
Tummy is big, okay, but I didn't notice any worsening of the tummy. Sorry.
Okay. And you feel like she feel like very hot in hot weather and she complains of the mama. I have like she feel very hot in hot and very cold in cold weather. Does she complain of this?
Nothing sort of like that actually noticed.
Okay, fine. And Smita, can you tell me like any concern of the pee and poo? Now she's like a big girl. She can tell us like any pee concern. How many times she passed the pee in a day?
Yeah, it's normal, doctor. There is no concern, and who also no problem. Once in a day, she does.
Okay. And what about any eye and ear concern is there?
Yeah, I concerned with the eye, is that because sometimes he's able to see, double, things, and so eye doctor has seen. They told that okay, there's some issue. It's becoming weak. Some eye nerve. I don't know what is that. Okay, it's becoming weak. They told. I don't know what is that.
Okay. Okay. Do not need to worry, Asmita. And what about ear and ear infection? Or any ear concern is there?
Uh, no, doctor.
Okay, fine. And how she looks like? Is she looks like you or his daddy?
Yeah, she's looking like us.
Okay, fine. And how she looks like? Is she looks like pale or pinkish in color?
She's color is okay. Yeah.
Okay. So can you tell me like any past history of any admission in the hospital in the 14-year journey?
When she was young, that time she used to have some, respiratory, like the infection. Okay, so that time, but one admission happened just a week ago. Okay, for the same this headache only. They admitted they did some, scans, actually head scans. Eye doctor seen. They removed some, water from the lower back area. They told that pressure is increased in the brain. I don't know why it is increased. I don't know. The MRI was normal, but eye doctor told that eye nerves are becoming weak and weak. So we are very, very worried, doctor.
I really understand, Smita. It is a really difficult for you and stressful as well. So the how many days you
Last
people
3 minutes left.
admitted? Yeah, how many days you people admitted? One
Uh,
week back,
so that time 5 days, yeah, was admitted. Yes.
5 days. Okay. And an history of travel,
History, sorry,
travel, travel.
what is reveal?
Okay, travel. Any like visit to any other site?
Oh, okay. So no.
Okay. Other than this GP and I team, other doctor is involved for the Lavi.
Dietitian, eye doctor, and yeah, and pediatrician.
Okay. Can you describe the birth of a Lavi for me?
It was normal delivery by
Okay.
cesarean section, and the things were uneventful at that time.
Any concern at the birth time?
No, there was no concerns.
Okay.
There
Any
were
allergy to any medicine or any food?
that time.
Now as well.
Yeah, now there is medicine that I don't know what is that, what to say. Some okay, something time of something. Okay, it's being given 3 times in a day.
Okay, okay, do not need to worry. And what about like Jeb's? Is she completed?
Yes.
Wow, how she's developmental? Is she developmental like his peers at the same age?
Yeah, yeah. We don't have any concerns.
And what she takes in the diet?
Whatever we make at home.
Okay, that's
Um,
fine. And what about like she's now like 14 years, so how is like her home environment and and sorry to ask this question, and what about puberty?
yeah. So she's having pubertal changes.
Okay.
She attained puberty.
And what about yeah, and what about home environment?
Yeah, it's conductive for her.
Okay, and what about education? Like she's now how's the school performance? She's a 14 year.
Yeah, school performance is good, going great.
And sorry to ask this question, and she achieves attends like the any parties, and have she any boyfriend?
She has girls and boys as a friends, okay, but I never saw her doing any other activities like smoking or drinking.
Okay, fine. And what about psychological impact on you people and how she cope with her condition?
Yeah, she is also very much worried. We are also worried too much, doctor. What's going to happen? Is this treatable, not treatable? Uh, is it going to affect her future, studies and her life? We are very, very, very concerned about those things.
Yeah, I really understand. It will be difficult for you. And so, how are you financially?
Time is over. So,
Okay.
could you please summarize your history and tell the diagnosis?
Yeah. Today, I got a chance to take a history from the Smita and mother of the 14-year-old Lavi. And she is complaining of the headache from the last 2 weeks. She is all over the headache, and it's the dull aching and throbbing nowadays, and also difficulty in a sleep as well. It is relieved for the short time with the painkillers, and she's associated with this vomiting date is like from the last 1 week, and it's more in the morning time, and it's like a projectile. And weight concern is there, like she has gained weight, and doctor gave him some medication and lifestyle changes. Her parents are very worried about her condition, and she has like she becomes nowadays like irritable, and she has concerns of the diplopia and increased blood pressures. And she the past history of admission like 1 week ago for the same complaint for this headache, and doctor done some CSFDR that shows some pressure increase, and MRI was done, that was normal. And she's achieved the puberty, and she also has a boyfriend and girlfriend, but she does not like take this alcohol or any smoking. Her parents are worried about like what happens in the future.
Mm-hmm. So, what is your diagnosis?
According to that, I will put on the top like benign idiopathic intracranial hypertension, pseudotumor cerebri that we call. And second,
Why?
I can put the
Why?
brain
Why?
tumor because she's obese and she takes medications. That is like mostly 3 times a day, and it can also cause this problem.
Medication? What medication is so? Because of medication, you are saying this is idiopathic intracranial hypertension.
No, further like this obesity, this vomiting is concern, and LP shows pressure increase. MRI was normal. So on the basis of this, I will put on the top like idiopathic intracranial hypertension, and second brain tumor. Third is going to be a migraine.
Mm-hmm. Okay, so why you're thinking of migraine? What so how exactly they will present and how severe the pain will be?
Because yeah, because this headache is from the last 2 week, and it's mostly in the morning time. So for that reason, I will put on the third, like this migraine. Otherwise, my top differentials are like this brain tumor and idiopathic intracranial hypertension. It could be a brain infection like meningitis, but she's no any complaint of this abnormal movements or any neck stiffness.
But that time they did neuroimaging, it was normal. So still you want to keep me with the
Yeah.
brain. just 1 week ago.
Then what are you saying then?
No, still you want to keep the brain tumor.
Second, on the second brain tumor, first is the idiopathic internal hypertension. Because
Okay.
MRI is normal and CSFDR shows like increased pressure. That are the favoring points, and she's obese as well.
Mm-hmm. Okay, all right. So what are the types of migraine? You know?
Yeah, like the tension. Yeah, that's a migraine. Uh, Migraine with ARA and migraine without ARA. Na? So this is like migraine with ARA because there is a vomiting as well.
Okay, all right. Okay, so what are the criteria to diagnose idiopathic intracranial hypertension?
Yeah, idiopathic internal hypertension we diagnose on the basis of the first one is the like obesity. It could be like and the other one is like
Is it a
medications.
mandatory criteria? Obesity?
G.
Is it mandatory criteria to diagnose idiopathic intracranial hypertension?
No, the top one is diplopia, constant and intermittent headache, and the vision disturbance. These are the criteria main, and obesity also. And the CSFDR done it is a, like increase, pressure. That are the favoring points for the
Mhm.
pseudotumor cerebri. Five are the criteria.
Okay, what are the risk factors for the idiopathic intracranial hypertension?
The drugs, it could be a drugs can cause NSAIDs
Mhm.
and antiepileptics, lamotrigine, and also the this vitamin A toxicity, vitamin D toxicity, also thyroid hormones when we take in the large amount. Means this like when medications comes in overdose, then this can cause this endocrine hypertension, VIH.
Okay, all right. So how do you manage this child?
I will manage this case involving my consultant, and I will do the supportive and the specific ones. So I will do the like the specific ones like a CSFDR LP, and I will also do the MRI brain. I'll send the full blood count with the erythrocyte sedimentation rate, CRP, and also like the serum calcium, and also send the this thyroid level, vitamin A level, vitamin D level, and the steroid level, means drug level.
Okay, so when you do the lumbar puncture, so what you want to measure? Which pressure you want to measure?
Opening pressure, elevated opening pressure.
What is a normal opening pressure?
Uh, it's
What do you
it's
expect?
yeah, it's mostly in the millimeter of the mercury, 20 to 25 centimeter in the centimeter, yeah, of the water.
Centimeter water. Okay, should be more than how much?
So more than this, like 30, 35, and 40, we can consider for the BIH.
Hmm. Okay, how will you measure that pressure, opening pressure? Did you ever try to measure the opening pressure?
No, I've never mentioned this, measured this opening pressure. When we like do the CSFDR, we will see na from this, like we have kill you the pressure of how from it pressure it comes from this back.
Okay, all right. So how will you manage the child further?
Yeah, I will manage this case by involving multidisciplinary approach like consultant pediatrician and neurologist and ophthalmologist because diplopia concern is there. And I will also involve the
So what do you
gastroenterologist,
expect
social
in
worker.
ophthalmological? What do you have to
G.
expect in ophthalmological evaluation?
Yeah, he will tell us about it means because the parents are concerned about like some things are
No, no, no.
weak in the
When
eyes, but they're not. What?
when ophthalmologists come and do the fundoscopy, what do you expect? What are the findings we expect in idiopathic intracranial hypertension? Eye findings.
Diplopia is there, papilledema, right?
Endoscopy, when you
Signs
do
of
the
raised
okay,
ICP.
diplopia will be there. Okay, diplopia will be there because of what? Because of the which cranial nerve palsy?
This
So which cranial nerve is
because of
affected? Sorry,
because of this like third oculomotor and the reducing nerve
is it
properly as well.
which is common in
Three,
raised in
four,
pressure?
yeah.
Which cranial nerve is mostly affected commonly affected in case of raised intracranial pressure?
So mostly it is six from my point
Ah,
of view that I remember and third.
Okay. When you do the fundoscopy, what do you expect?
And then I will see for the involvement of this abducens nerve and lateral rectus muscle supply, and how it's our eyes are deviated towards which side.
Okay, sure. So yeah, how will you manage further?
Yeah, so I will avoid this precipitating drugs like this steroids, and
What
also
is
this
the
vitamin D, vitamin
what is the
A.
underlying
G.
what is the underlying factor here, precipitating factor here for this child?
Because here is obesity, so I will deal with this lifestyle modification I will tell about, and for the diet as well, and I will give him a head elevation. I will do give him the IV manito, like the rest ICP signs are there.
What is the first line drug you want to prescribe for for the idiopathic intracranial hypertension?
Hypertonic saline we will give, and before that we will do the head elevation. After that IV manitol we will add. Also we will add the acetazolamide, that is the carbonic anhydrase inhibitor.
Hmm. Okay. So this child is not responding. Okay. Then what do you want to do?
Then I will do the means involve the neurosurgeon, and then I will do the surgery.
What surgery?
But I will do not this. First of all, I will do this, give the medications, and after lifestyle modification, then I will do this lumbar puncture again to see the
Okay.
result.
Repeated
Then
lumbar
after
punctures
that,
are being done. Okay. Still not responding. This girl has come back to you.
then I will involve the neurosurgeon for further management.
What neurosurgeon will be doing?
He will do the surgery to this remove
Surgery.
RM. Yeah, and after the radiotherapy and chemotherapy,
What
maybe
you want to
after
do?
surgery.
All right, okay, it's discussion is done. Okay, let's do the discussion because I don't want to stretch you more. Okay, all right. Okay, so how was it, Mala? Z.
I don't know, sir. Then now you tell me, because I am doing this.
Okay, where are you from, Mala?
From Pakistan.
Pakistan. Okay, so where in Pakistan?
In Pakistan, in the Sakha.
All right. So, guys, okay, I want your feedback. Um, so how was Mala's performance? Do you agree with her? Yes. One by one, you can give the feedback. Falak, how was it? Okay. Dr. Bhavana Kumari, do you want to give the feedback?
Yes, sir. I think it was okay. But
Mhm.
brain tumor, I think we couldn't keep here because the MRI was done and it was normal.
Mm-hmm.
And other we can, she didn't ask about the family history of the migraine or and. But for me, this was the case of IIH,
Yeah,
idiopathic
yeah. She
intracranial
told that
hypertension.
IIH actually, idiopathic intracranial
Yeah,
hypertension. She told actually.
yeah.
Okay. Yeah. Family
Other
history
than
should
that,
have been
I
asked.
think,
I agree with you.
yeah, family history of migraine because we can
Detailed,
keep the migraine
detailed family
detailed
history is
family
very, very
history.
important. I agree. Totally agree with you.
Yeah,
There's some background noise coming. Okay. Please make sure.
yeah. It was from me.
Oh,
That's why I was
okay.
not
Okay. No
talking.
problem. No
Sorry
problem.
for it.
Thank you. Thank you. Okay. So anyone else? Sherry's Gill, Gull. Okay. Sorry. Do you want to say something?
I think a few red flags were missed that would have made a diagnosis. Even it was clear from the beginning. You gave nice clues in the history of obesity and overall child weight. So it made the diagnosis very easy. But I think the history must have gone through the red flags after she has located, like she had done Socrates, which she did nicely. But then I think next was red flags didn't came up next. Next was systemic examination, and then she moved to birth history and obviously, I think she missed family history. She asked about social history.
Yeah, so social history, family history, social history is very, very important. Okay, she should have done it. I agree with you. Yeah, okay, good. Anyone else? Dr. Shahida, Rebecca, Ikra, Sarika, anyone?
Yeah, I
Actually,
think
sir,
when she asked,
Yeah,
sorry.
Sarika, go ahead, go ahead. Yeah,
Okay, so when she asked about the headache, I think it should have been in a more detail in the first place, like since when, what aggravates it, what reduces it, what time of the day, is it really
very
disturbing
good.
her sleep, is it affecting her growth, is it changing her behavioral pattern? So yeah, like Serish said, the red flags. So maybe these should be there in the ODP itself, the first complaint of analysis, and
Very
maybe
good.
whatever is left, then she has done it, like in the systemic review.
Okay, so okay, any pain, suppose okay, pain is there. So what is a like pro forma, like how exactly, what are the things you're supposed to ask? Okay, what is this liquid for? Anyone
So
can?
it's, yeah, I can tell. It's location, intensity, quality,
Very
duration,
good.
frequency, associated symptoms. In this case, it could be nausea,
Other
vomiting,
features in the form of nausea,
other
vomiting.
symptoms. Yes,
Okay.
and effect, E for effect, which means effect
That's
of what is affecting your
sleep,
daily life or
schooling.
your school in this case.
Fantastic. Okay. So many people use many things. Okay. I like either old card or liquid for. Okay. So you can go
Sir,
for
there
the.
is one as well, but that is for pain. Socrates. Is
Yeah.
it same or
Yeah, the pain, any pain is okay. No problem. We can use liquid for. Okay. Any pain is the old card, you can use our liquid for whatever. No problem.
Sir, but I have used the Socrates, and Socrates is also for the headache.
Yeah, I agree. As Socrates is also there. Yes. I agree. Socrates. Okay. Anything is no problem. But this is given in your book. Okay. So we are using it. Okay. Okay. Anyone else? So the location, okay, intensity, quality, duration, frequency, okay, other associated, symptoms in the form of nausea, vomiting, diplopia, or, like, seizures or, those things, and is the effects in the form of effects of this headache, like, so quality of sleep, schooling, and those things, and yeah.
Sir, he asked about triggers or not? Maybe I have missed.
Yeah, she asked about triggers, other medications, and okay, I think, did you ask?
Yes,
I
sir. I'll ask the family history, miss.
No, but treatment history, what, like, any other medications other than that astazolamide, did you ask about that? You have to ask, okay, any time taken, any vitamin A, vitamin D, you can specifically ask also, no problem. Okay, okay, yeah. Sometimes what happen, no, I tell you guys, okay, maybe pediatrician might have prescribed vitamin D, okay, for the therapeutic dosage for the vitamin deficiency. Sometimes, because they will read in the newspaper, in the media, that vitamin D is very important, okay. So they will just try to give one more like dose. So we end up with the vitamin D toxicity. Yeah. So that this can happen actually. But ask about that, okay. And yeah. And details about that admission, okay, so you should have asked actually. Yeah. So was there any, abnormal movement that time? Like, what kind of imaging was done? What was the finding? Okay, so what were the tests done? What was the treatment given? How was the child at time of discharge? How is the school now? School affects the school, and yeah, sleep disturbance and other things you ask about schooling and other things. Okay, social history and about yeah, social had triple SCGC. You try to dig that history. That's good. Fantastic. So, but family history is also important at that same time.
Yes,
Okay,
sir.
anyone else? Yeah, anyone else? Aarti?
What specifically would we cover in family history? Like the stresses?
One thing is family history of obesity, family history of breast tumor. Okay, any other chronic condition which is running in the family, you need to just ask how is it affecting? Are they getting any support? Okay, psychological
Okay.
thing. Yeah.
No, pertaining to the headache, I'm asking, like any
Any history
specific
of
family
similar
history.
complaint in the
Migraine.
siblings?
Migraine is
migraine,
the
obesity, any family history, brain tumor, anything is
obesity.
obesity. Yeah. Okay. Anyone else want to share your
I
feedback?
think she did. Now most of the points are covered, but
Mm-hmm.
in the headache red flags, we should ask about any focal deficit, whether like rule out intracranial tumor also in the history.
Mm-hmm. Mm-hmm.
Mm.
Okay. All right. Okay. All right. Sure. So very so thank you very much for all your feedback. Okay. So now I will give my feedback, Mala. Thanks for the participation.
Thank you, sir.
Yeah. So we should also say thank you to Bhavana because she sacrificed her.
Thank you, Dr. Bam.
Yeah. All right. So overall, it was good. Okay. So you can do better than this, Mala, but definitely you'll pass through this. Okay. So you'll get, out of 10, you can
Thank
say
you.
8, 9. Okay. Maybe 1 or 2 marks will miss. Okay, Mala. But
Thank
but
you.
overall, it was good. Okay. Because it was very crystal clear, isn't it? So she was admitted and they did lumbar puncture, put on astazolamide. Okay. So still headache is not responding. Very straightforward. Okay. But only in the management somewhere the theoretical knowledge you need to just read. Okay, so we will do that. Okay, before exam. Don't worry. When is your next exam, Mala?
When is my exam?
Yeah.
19th October.
Okay. So hardly 25 days left out. Yeah, but you'll do it. Don't worry. Okay, so the initial introduction, Rapu, and after that, okay. But I was expecting you to talk to this girl. This is adolescent girl. You should have spoken to. Okay, in between, I was getting confused. Okay, so I wanted to, behave myself as a girl, So you should have actually taken more history from this girl rather than a mother. Okay, so I feel like, or maybe from both, you can say like, and I'm going to ask details about the health concern for the lovey. Okay, from you. Okay, in between, mom, you can add to that. Okay, you can ask, or maybe you can ask more history, but you can ask that girl to add to the history. So you have to take history from both actually, but
Yes.
mostly. So this girl is big actually because it's more reliable. I feel like uh, because she's
Doctor,
uh,
even if the task is from the mother, still we will say that
Talk
we
to
would
mother.
like to ask
it
the
was
mother.
mother. Okay, I didn't see that actually. So still like
Yeah, sir. Statement is talk to the
okay,
mother. So
then you
partly.
can take history from both. Okay, then they can
Okay.
take.
Okay.
Yeah. So all right, and
Excuse me, sir. Are there two role players then in that case?
no, you don't get actually role player. You don't get actually, but it's just like it's simulating like a
Okay.
real time patient and so you will be having role player only.
Okay.
Yeah. Okay. Okay, so after that, yeah, so you were empathetic. Okay, you start like asking questions. Okay, so I want to know more about this headache. Okay, so open-ended questions and onset course progression. Okay, so associated symptoms. Okay, then basically you need to like so where is the headache? Of where exactly? Can you just tell me where you having the headache? Is it in the front side? Is it all over? Like is it back side? So that is location is important. Okay, the intensity of headache you ask actually the basically
Yes.
scaling. Fantastic. Okay, so what is the type of the pain? Okay, so previously it was the like later it become more intense and so
Yes.
yeah, and it's more of like pulsating, throbbing, kind of thing. Um, okay, and after that, yeah. So is it the first time it is happening, or was he having the headache before? Also, you have to ask like, okay, so is it there for last 2 weeks, or was it there before? Like so that you got to ask. Okay, and how frequently? What is the duration of each episode? Like is it intermittent or is it continuous? What kind of headache is that? Okay, so that is important. Okay. Then associated symptom is it associated with any throwing up that you ask, okay, any abdominal movements and anything, okay, eye issues in the form of those double having double objects, seeing double objects, diplopia. Okay.
Yeah.
And when is this headache more? Is it in the morning? What time of the day the headache is more? Is it in the morning hours after getting? from the sleep, or is it in the daytime? Is it in the end of the day? So if it is at the end of the day, okay, and no throwing up is there, and maybe tension headache or other things will be there, like So, um, and okay, it could be any other like chronic headaches, primary headaches. So basically, you want to know whether is it a primary headache or secondary headache. Okay, here. So then, yeah, others, any history of eye infection, any infection in the bug infection in the ear, those things, any other eye issues. Okay, so other than this double vision, anything is there, any infection, anything is there, recurrent throat infection. Okay, then any bug infection in the brain, those things, any abnormal movement. Do you have any concern for the hearing, any behavior concerns you have? Okay, so those things you have to ask. Yeah, and what?
Yes, sir.
Yeah, and then you have to ask about systemic review, and then you have to go for that. Okay, systemic review, you have to do it like in detail, like any history of um, any weakness in any part of the body. Okay, so then any concern, like whole from head to toe, you have to go for the systemic review. So, and other than that, so day-to-day activities, is it affecting sleep, day-to-day other activities like schooling and other things? That's very, very important, okay? Because these are red flag signs, okay? If the child is getting up from the headache in the night, the headache is happening in the early morning, if it is, there is a persistent throwing up in the, like, so
Yes.
projectile vomiting and yeah, so intensity worsening over a period of time. And if it is affecting schooling, if the people, it's like, sometimes, so there is a neurological deficit, anything, diplopia. So these are red flags actually.
Yes, sir.
Yeah. No, you have to ask those things. Then you have to go for the past history. Was there any similar symptoms in the past? Was he admitted anytime? Okay, and details about that. The previous admission 1 week ago, she was admitted for the same, and what were the investigations? What was the finding? What were the findings? What was the treatment given? Okay, I want to ask you guys, what is our normal opening pressure, and what do you expect in this case? Idiopathic intracranial hypertension.
More than
It is
So
28.
more
that's
than
more than
28.
28 centimeter of water.
Is it centimeter? Yes, it is centimeter.
Mm.
We always get confused with the millimeter of mercury and centimeter. What isn't it?
Mm.
Okay, what is normal opening pressure then?
Sir, it varies in
20 to
children. It's
25.
yes,
20,
10
20,
to
25
mm,
centimeter of the water.
not more than that. Okay. So
Mm.
yeah, and sometimes you have to ask like sometimes coughing and those things. Okay, is it worsening? Okay, so change in the position or coughing or straining or anything, is it worsening headache? Okay, if it is worsening, it's again red flag. Actually, sometimes pubertal changes. Okay, so that could be advanced pubertal changes or something. Headache, associated headache. Maybe you have to think of brain tumors. Central cause for the precocious puberty or something. Those things. And yeah, so birth history is not that important, but yeah, definitely here the treatment history and the family social history is very, very important here. So because the thing is that in the exam, you are not supposed to miss the family social history. It's very, very important. Okay.
Yes.
So yeah, how many members are there? So instead of asking open-ended question, you have to ask close-ended questions. Okay, how many members are there in the family? And what about others? Are they okay? Any history of similar condition in the family? Okay, anybody is having headache? Any history of brain tumor? Any migraine attacks? Anything? Any chronic any illness in the family? You have to ask. Okay, and are they getting any supports from the government? Okay, what about schooling? Okay, then so home environment, schooling, education, those things. Okay, so is any history of like the alcohol and other drugs intake? Okay, smoking and those things. Um, yeah. So
Yes, sir.
yeah, health triple is that is very important. Okay, that personal history, home environment. Okay, education,
Re-education activity.
Okay, alcohol, alcohol, then drugs. Okay, then sex, self-esteem. Okay, and suicidal tendency.
Social life. Mm.
Suicidal tendency. Okay.
Mm.
So those things you need to ask that you did very good, but family is the bit actually. So to do that in the exam, okay. So
Yes, sir.
after that, you have like So when last 3 minutes in laboratory test, you will be having ringing up the bell. So out of that 30 minutes, okay. So at the end of the 10 minutes you'll have a ringing. So 13 minutes is meant for the history taking, then after that 9 minutes meant for the discussion. So discussion was okay, but I was expecting you more like, so this child already is on astazolamide. Okay. So definitely management is multidisciplinary team-based approach here. My team members include GP, community pediatrician, okay, neurologist here, important neurosurgeon also you have to involve, dietitian you have to develop, okay. So then social support group, okay, okay, counseling also might get affected psychologically, so camps team might be also required, okay. So because mother is worried, but the girl is also worried about the future and those things. So the medical management includes first of all, like management of the weight. Okay, for that, okay, dieting is important. Diet, it's like protein rich diet. So basically fresh fruits and vegetables and yeah. So protein rich diet is advisable. So exercise at least 20 minutes a day, if not 1 hour per day for 5 days in a week. You have to lifestyle changes. Okay, so avoid junk foods, fast foods, okay, outside foods. Okay, so avoid high calorie, high carb diet foods. Then yeah, exercise is important. So those things are told. Then regular follow up. So estrogen dose, if estrogen dose, if needed, you can go up on that max. Then so repeated lumbar function. So if that is not helping in this child, okay, then you can go for the surgical treatments in the form of sometimes they will go for the ventriculopetal stent, ventriculopetal stent, and some EVD insertions are like so those things, neurosurgical interventions are really required. So sometimes even so initially you might get optic disc edema, but later they can lead to optic atrophy. So that will lead to vision loss, color vision. Okay, ophthalmological evaluation in order to know optic atrophy, then color vision, field of vision assessment is important. Okay, so that's what I was expecting. Okay, then what is the most common nerve which is affected in raised intracranial tension? It is sixth cranial nerve. Okay, so what is that nerve? What is the name of the
Abducent
nerve?
nerve.
Abducent nerve.
Abducent.
Okay, so that leads to squint. What
Yeah.
kind of like the squint you'll get? You'll get like medial squint, isn't it? Like, so because of sixth cranial nerve, so you'll get medial squint. Okay, then diplopia, those things will be there. So ophthalmological follow-up and is very important. How will you manage the sixth cranial nerve? So once you manage this raised intracranial pressure, usually the recovery will be there. Okay, so and other than that, yeah. So these are the only things. Have you
Yeah.
ever managed a case of idiopathic intracranial hypertension?
I have seen, sir, I have done a CSF manometry
So you have to use
once.
spinal manometry and you have to monitor. Okay, so just like
Mm,
well, okay, you have just to connect with the three-way and that manometer, you have to see how much pressure it is going up. Like
yeah,
to
yeah.
be fantastic. Okay, so the risk factors for the idiopathic. So yeah, here the difference. First diagnosis is idiopathic intracranial hypertension. Second thing, it could be other other secondary headaches. It could be some space sarcophageal lesion. However, the previous MRI was normal, but this time, okay, not only just MRI you have to do. You have to go for even MRI, MRV also. Okay, so that's very important. Whenever neurological deficit or diplopia something is there, you have to do that. Okay, that's very very important. Then third thing is yeah, migrainous headache, like primary headaches. Okay, so it could be cluster headache or migrainous headache. So what are the primary headaches, guys?
Tension headache, cluster headache, and migraine.
Mm-hmm. In between, actually, we spoke in Hindi, Urdu, and now Zoom is asking, okay, so do you want to translate that? Okay, I told no. Sorry, go ahead.
Tension, cluster headache, migraine.
Tension headache, okay, migrainous headache, okay, then cluster headaches, okay, these are the primary headaches, and okay, so which one is having severe headache? Which primary headache is having severe form of the headache?
Upper.
Lesser headache is having severe, okay? It's very severe, okay? 9 to 10. Moderate headache you will get in case of migraine headache, okay? So, and tension headache, usually mild to moderate pain will be there. Okay. All right. So, how do you treat, what is the long-term prophylaxis for the migraine headache, guys?
First of all, we give the NSAIDs. After then, triptans we give.
Acute management of the headache and long-term, migraine prophylaxis, I'm asking, maintenance therapy. What are the
First of
prophylaxis?
all, we have to reassure like non-pharmacological treatment. Na? Like first, we relieve the factors. Example, like poor sleep is their attention at home and bullying.
Yeah, good
So first
hydration,
of all,
sleep,
we
okay,
change.
relaxation, those things, okay, very good, fantastic. Medications, I'm
And
asking.
medications are triptan. Abortive treatment is there and prophylactic. Na? Abortive we begin the triptans, analgesics like naproxen, ibuprofen. And prophylactically, we give the propranolol, tricyclic antidepressants, amitriptyline, and
Okay,
tension
paracetamol,
blockers.
ibuprofen, you can't give it for a long time, okay? So I'm asking like
Yeah,
prophylaxis. First drug is propranolol, beta blocker, yeah, okay? That is,
beta blocker.
this drug is licensed and also it is recommended, okay? The propranolol. Then we have topiramate, okay? So topiramate is licensed, but it's no, sorry, it is unlicensed, I think it, but it is recommended. Then one more is pizotifen, okay?
Yes,
So pizotifen is again, I think it is,
serotonin 5-HT.
is it licensed, but it's not recommended, something is that. Yeah.
Mm.
So these are the three drugs which are usually used for the long-term maintenance therapy in case of migraine headache. So then next question they will ask about is what are the red flags in case of headache? Okay, so who is going to, one person I want, okay, so can tell the answers. Ikra.
So red flags are like it wakens from the sleep and morning are recumbent from the lying down and headache is worsened.
Okay.
Also the occipital headache is the red flag and headache that is worsened by coughing or
Why occipital
straining.
headache is a red flag?
Because this is a sign where we put the pressure. It also causes vomiting and this throwing up.
Okay, so morning headache, worsening headache, okay, so projectile vomiting, sleep disturbances, okay, I agree. Then
And
worse,
also headache worsened by coughing
severe
or
headache and
straining.
worsening headache also, okay?
Yes.
Okay, then neurological deficit, okay, cranial nerve palsy, yes,
New onset of lethargy is
new
also
onset,
red
okay,
flag.
worsening headache, any precocious pubertal changes, headache associated with
Mm.
okay, pubertal changes, then any associated to neurocutaneous syndromes, because you have to think of brain tumors and those things, okay, then
Mm.
what else? Academic performance is going down, okay, that is also we missed, okay, that you have to ask, okay, if the academic performance is going down, so that is also a red flag.
Mm.
So all these are the indication for the thinking of secondary headaches and going for the neuroimaging. Okay, so is that okay
Yes,
with
sir.
you, Mala? Yeah. Any questions, guys? I think that's good enough for the day. Okay. I was thinking you can do it third case because one case it will take 1 hour, so that's a issue. Any questions? No questions?
Sir, I want to just recap the DGs. So we will keep the idiopathic intracranial hypertension, and we can keep the SOL as well here or not.
Yes. I see. So you can give us still, okay. So there's a possibility. We don't know, okay, what kind of imaging or was it done, okay. Was it a CT scan initially? MRI, you have to make sure, okay. If it is only CT scan, then you can go for the MRI, okay. I agree. Migraine headache you have to give, okay. Sometimes, okay, so headache, okay. Second headache due to maybe because of the refractory error, okay. Sometimes ear infection, the nose infection, sinusitis, so those things you can also, I can keep. Yeah. Okay, guys, then. So was it helpful or not?
Yeah, it was. Yeah, it was very helpful. Thank you, sir.
Yes, sir.
Yeah,
Thank you, sir.
no problem. Welcome.